Myths out there when it comes to this particular topic of hormone replacement therapy. One of the topics that I always hear covered is brain shrinkage. Does this therapy shrink the brain at all?
Absolutely not. If it's with bioidentical hormones, the bioidentical hormones actually significantly prevent brain shrinkage and prevent Alzheimer's and mental decline. And this is what happens when you take synthetic estrogen, oral estrogen, and a synthetic progestin. You actually get increased inflammation and increased brain shrinkage. So it's not the problem of hormone replacement. The problem is, again, they lumped it all together. It's with the synthetic estrogens and progestins. Now, progesterone is required for the baby to grow. That's the natural bioidentical progesterone. Progestins, again, are the synthetic versions that are altered, and they have very opposite effects. Again, one causes brain shrinkage. One causes breast cancer, the progestin, and progesterone significantly reduce risk of breast cancer. And doctors lump these together and say, well, they work the same on the same receptor, the same thing. Well, a very simple explanation that they are not is progesterone is, again, required for the baby to grow. That's what keeps progestational hormone required for the baby to grow. Progestin is the morning after pill. Completely opposite, obviously. So they work, they're very different, although they're often lumped together.
You suggest that there are some questions that a woman should answer before deciding on hormone replacement therapy. I want to ask you a couple of those. You talk about the goals, and what are my goals taking hormones? I mean, what should the answer be?
That is different for different women, and most of the time the goal is going to be for symptomatic relief, and we talked about that. So, they're going through menopause, and like, oh my gosh, I feel terrible, I can't sleep, I can't think. I'm having hot flashes. My quality of life has significantly declined. So that is a good option for hormone replacement. Now, what the standard is to say, well, just take hormones as small amount as possible for the shortest period of time because of the health risks associated with synthetic hormones. So with the bioidentical hormones, you get the other reason to take hormone replacement is for, again, to prevent disease, to prevent Alzheimer's, to prevent heart disease. And so you get the benefits of both.
If folks are just joining us, I know you mentioned doctors a couple of minutes ago. We're talking with Dr. Kent Holtorf about hormone replacement therapy. Let me ask you again, what doctor should women go to for this? Just their general physician or somebody specialized?
It has to be a specialized doctor who understands this. And that's the biggest difficulty is finding a doctor that's knowledgeable in this, because typically, let's get endocrinologists, very, very few even understand and know about bioidentical hormones, because it's not taught at their conferences or in residency. Gynecologists, again, also have to have had to gone out and sought out this information for their patients. The overwhelming majority don't know anything about bioidentical hormones and will say, well, they're the same, there's no difference, because they haven't read the literature, unfortunately. So generally it's going to be family practitioner who has gone to the conferences and really learned about bioidentical hormones, but it's sometimes difficult to find. They can look on the internet and ask around and find out who's doing these, and it's not the simplest thing to find a doctor that's knowledgeable in it.
What are the serious risks?
With the risk, we know the risk of the synthetic hormones, which are increased risk for breast cancer, increased risk for heart attack and stroke, and those are well documented for the last 20 years. And it's interesting, when the Women's Health Initiative study came out, it was the very large randomized trial showing that hormone replacement had these risks. And it was funny. It was, oh, my gosh, this is a new finding. It wasn't a new finding. It was shown over and over and over. But when you look at the studies on bioidentical hormones, there's 30 years of studies showing that they actually reduce the risk of breast cancer and have significant cardiovascular protection, and they have the benefits without those significant risks. Now, is anything risk-free? No. But when you look at evidence-based medicine, you want to go on the best evidence we have right now. Really shows that these are preventative and not resulting in increased risk for these things when they're done right. Some doctors, again, one of the best ways, for instance, to prevent breast cancer is take progesterone. One of the best ways, if you would want to do it, is to increase breast cancer, take synthetic progestin. So you need to make sure. The doctor needs to make sure that there's adequate and significant amounts of progesterone. And again, that will prevent breast cancer. Do we need more randomized long-term studies on these? Absolutely. But the current evidence demonstrates clearly that these are very safe preparations and safer than synthetic.
Is age a factor when it comes to hormone replacement therapy?
That is a very good question, and because what was found in the Women's Health Initiative study, the women were off of hormone replacement for on average 10 years. And then once they started them on hormone replacement, they immediately had a significant amount of heart attacks and strokes in the first year. But this was because, again, they gave them oral estrogen and progestin. So the standard is most doctors say, well, you shouldn't take hormones if you've been off of hormone replacement for over 10 years. But that's not true with the bioidentical hormones when the estrogen is given in transdermal or on the skin through the skin preparation.
How often should your case be reviewed if you're undergoing this therapy?
It really depends, and because, again, typically the patients used to go to the doctor, here's your hormone replacement, see you later. But with the customizable, we can do many different doses. So typically the patient would want to be seen almost every month for about 3 months, and then after that, every 3 to 6 months.
You just mentioned research when we were talking about risks. Research as a whole, where are we? And do you think that there's any part of that research lagging behind?
We really need more research. And the problem is, again, these are typically, most research is funded by drug companies, which has certainly negatives because of that. But that's where the money comes from. And when these bioidentical hormones, they're custom-made by compounding pharmacies, so they don't have the money to do these long-term, very large randomized studies. So we have to look to the government to do some more of these comparative studies. So yes, we definitely need more research, but there has been a significant amount of research done. Again, that's what I reviewed in my paper in postgraduate medicine.
Dr. Kent Holtorf is with us talking about hormone replacement therapy. He's a leading authority in the field of hormone replacement therapy, and he's a board examiner for the American Board of Anti-Aging Medicine. Is there a website for folks to go to if they would like to learn more about hormone replacement therapy?
We actually have a lot of information on our site at www.holtorfmed.com, HOLTORF med.com. There's also the Bioidentical Hormone Initiative website. There is A4M, which is worldhealth.net. We'll have a lot of information about bioidentical hormones.
Dr. Holtorf, thanks so much for your time.
Thank you so much.
Much for your time.
Thank you so much.
Much for your time.